particularly in response to this COVID epidemic, or SARS-CoV-2, which is the virus that causes the COVID-19 disease. The objective of this program from the state perspective is really providing timely, objective, and granular information to decision makers. So timely means that this is kind of a relatively quick turnaround. We can sample sewage, we can ship it to a lab, and we can get the results back just as fast as a diagnostic test, if not faster. Objective, meaning that, and I'll get into this later, what we're getting from the wastewater is a relatively representative sample from the community, which is something you can't really get by individual testing, at least not practically or ethically. And then granular, meaning on sort of on a citywide scale. So we're not talking about county level, we're not talking state level, we're getting down to the city and town level. So that's really the kind of the main objective. And it's really just providing that information to decision makers, to include the governor, state health officer, county health officers, local officials. And so they have sort of a situational awareness of how the pandemic is progressing across the state, and that hopefully will support targeted policy responses. So instead of maybe a statewide blanket order on something, we might be able to target that policy to a specific area where there's data to show that the epidemic really is kind of raging or not. So that's really the primary objective of this, what we're talking about here. And I think the secondary, if we make this data public on a public-facing dashboard, and that's a decision that's above my pay grade, and we're certainly going to be discussing that on the state level, the pros and cons of that. But that would help people in their community understand what the risks they might be facing, you know, in a sort of objective sense. What does the data say about what the real prevalence is of the virus in this community? And so that is a double-edged sword. You know, if it's bad, you know, obviously it provides people information about that. But if there's low prevalence, or we're not detecting it in the wastewater, that doesn't mean it's not there, but it might mean there's a low enough prevalence that people can feel better about you know, going out and eating at restaurants or shopping or what have you. So again, double-edged sword, but I think there's some value in providing objective sort of risk, at least a relatively objective picture of the risk in a local community. So why wastewater? What's interesting about this particular pandemic is that there's a lot of evidence that there's people with COVID-19 shed a lot of virus in their feces. Now, that's not the case with a lot of viruses. So this whole technique does not necessarily apply to other surveillance efforts, but it might be really useful in this particular case. And what's nice about the wastewater is that the sewer systems, you're channeling sort of a representative viral load that's also de-identified. So we're not having to, you know, the alternative to really getting the same information is randomly sampling. So, you know, forcing 1,000 random people in a community to take a test every week, which is really not feasible, ethical, or cost effective. So in a way, the looking at the wastewater is kind of getting that random and de-identified sample on a community level into a channel to a single point for collection and analysis. I do want to stress, though, and I'll stress this throughout the entire presentation, there's a lot of uncertainty in this. A lot of unknowns. This is a very new field. You know, I think there's a lot of questions that we don't necessarily know, and so getting actual results, we're not really sure what the data is going to look like yet, and we're not sure how much we'll be able to translate the data we do get into something that's really actionable from an epidemiological perspective, looking at, you know, what is the rate of transmission, or what is the, you know, prevalence in that community. There's a lot of assumptions that underlie that, and I'll get into some of those, how we're going to model that. But I do want to stress that this is a very new thing. We don't necessarily know, you know, how the data will look. But we do know that, as you can see in the last bullet point, that there is some effective lower limit of detection, so that the tests are not going to pick up a certain number of low incidence cases. There's going to be some threshold, which you don't know exactly where that is, after which, you know, the viral load will be detectable in the wastewater, particularly once it goes through all the lab extraction processes. So just an overview of the process, how we envision this. The blue is kind of what the municipality or the wastewater operator would do, and I'm showing a sort of a timeline here for those of you on the phone that may not be seeing the screen. Like a 6-day timeline. You know, what we're asking folks to do is do a 24-hour composite sample, so not a grab sample. Hopefully, ideally, be a flow proportionate sample, but we recognize that's difficult to achieve. So in many cases, it'll be just time proportionate composite sample. So, and I've kind of annotated kind of what happens. The wastewater sampling takes a full 24 hours. There's going to be some prep of refrigerating the sample and putting it into the kits that we'll provide. At some point in the day, there's usually a pickup time when FedEx will pick up samples, and so that's usually in the afternoon. We intend to use overnight shipping, again paid for by the state, to get it to the lab, and then so it arrives at the lab the next morning. We're shooting for a target of less than 3 business days to do the testing. We're really going to see how this shakes out with our initial 4 entities that are participating, but we really aim to turn this around quickly. And then the goal really is this. You can see this arrow here, having the lab results immediately available. So once the lab notifies the rest of the department through this internal sort of spreadsheet, those results will be immediately available on this dashboard that we're going to build. And then periodically we'll do some modeling on that to try to translate these the raw data that we're getting from the lab into something that may be more useful for decision makers. And that timeline may be a little bit further out, and we may need some trend data, some multiple days or weeks of samples to be able to process that. But this is kind of how we see notionally the timeline going for each particular sample. So it is a relatively compressed timeline, and I think it's just as the turnaround is just as fast as any other diagnostic testing, with the exception that instead of a nasal swab, you're doing a 24-hour sampling here. But the shipping, everything else, would look similar. So we do hope this to be as timely as possible. The sampling process, we really want to make this as easy as possible for communities to participate. And we're really trying to solicit as many towns to participate as possible. There's no real limit. There's not a competitive process. There's no limit on the number of people that can participate, aside from the fact that you'd have to be a municipality, a governmental subdivision, that owns a wastewater facility. And that's just really the main focus of this. There's obviously probably some upper limit of a couple hundred folks or entities that might be able to participate if you really got down to really small towns. We're hoping for at least 50. That's really the goal initially, is to get that kind of level of participation. And to get there, we're really trying to make it easy. So we will, for example, these composite samplers, they kind of look like a refrigerated bucket with a fancy pump and computer. They run between $3,000 to $8,000. We want to reimburse up to a cap of that. $4,000 is currently what we're in our draft contract. We will send you, the operators, prepackaged sampling kits, so you won't have to go and try to buy materials on the open market. We will provide the shipping, so we'll pay for the FedEx. We will also do the testing at no cost, and we will in fact pay you, the operators, $300 is the number as a marker we're putting in the contract right now. $300 per sample submitted for up to 3 per week, because we recognize that each sample can take up to 2 to 5 hours of labor to set up and take down and process. So we do want to compensate you for that. And finally, we're exploring the idea of a contract with the Association for Rural Water Systems to do technical assistance. So they already have a well-established circuit rider programs. This would add on to that and essentially provide technical assistance on how to do the sampling and set up the composite samplers and whatnot to make sure that we can get as many folks participating as possible. So we hope this is a pretty good deal. Again, we're trying to encourage maximum participation on this. As I mentioned before, this is really a new process. We're still learning on the state side. The lab is shaking down its initial protocols for how it's doing all this, doing the extraction and the testing. We're going to be staging the sampling in 3 waves just to keep demand on the lab manageable and up front. So the first wave, again, is entities that are already doing this. So cities like Cody, Jackson, and Laramie, and Yellowstone National Park, which is not a city, a federal entity, they have been already contracting with an entity, private companies to do this. So they've already been doing the sampling, and we're just going to essentially take that work, hopefully, and do it for them for at a much lower cost. And then the second wave would be larger cities. So we'd like to prioritize this by population. We'd love to encourage that basically down, if you look at a sorted list of cities in the state, by population down to Torrington, I think is the cut point for that top 14. And I've emailed a lot of your wastewater operators already on the spam list. But those would be larger cities, not only that have bigger populations, but also may have that composite sampling capability in-house. Already have the kind of equipment that can do this because they're required to for other environmental reasons. And then the third wave would be any smaller operators that would be interested in participating. And so ultimately, we'd like to see all three waves in by the middle or end of July. So we are anticipating a rapid process. Don't feel like you're going to be left out. The only reason we're sort of doing this initial testing is just so we can really work out some of the bugs before we really start expanding it to a bunch of other folks. And as far as the testing goes, the public health lab is really developing a process right now to extract the RNA, the genetic material of the virus from the wastewater. But once it's extracted, the process is actually very similar to diagnostic testing. So we're not having to buy a ton more new equipment or train a bunch of new staff on how to do this. It's very similar to a diagnostic test where we have this what's called a polymerase chain reaction. It amplifies the RNA, and I won't get into the technical details here. I certainly can't speak to them, but at the end of the day, we can estimate, sort of a rough presence absence, like a positive or negative test, and a rough concentration, of how many copies per milliliter there might be in that particular lab sample. And so, again, I would point out there's that uncertainty, right? If the concentration in that sample is really below a certain detection threshold, we're not going to pick it up, and it will report as a non-detect. But that doesn't mean the virus wasn't present in the white wastewater or isn't in the community. So there is, a bunch of uncertainty with this process and some grains of salt you got to take the results with. Once the data is tested, once we get the testing data from the state lab, we will process the data. The raw results will only really tell you concentration in a sample. So what is knowing that there's 5 copies per milliliter? What does that tell you? Or what does it mean if there's 50 copies per milliliter? It's not really as helpful as, you can know if it's going up or going down, if it's presence absence. But what we're really trying to do is model this, model the data, and really try to estimate some more useful information from this, like what % of the population might have COVID in that community, or what's the trend? What is, if we assume there's a certain epidemiological curve, this infection curve that happens, what's the attack rate of the virus? Those are kind of the things we're really trying to estimate, and it's going to be interesting to see how the real data looks, and try to model that, because there are a lot of unknowns in that. We have a model of how people might excrete a certain amount of virus into the wastewater. It might travel down the sewer and might degrade at a certain half-life. It gets sampled, assuming it's all well mixed, and so on and so forth. A lot of assumptions. We're not including things like, the location of infected people in relation to the plant. If someone with a really low viral load is really close to the plant and someone with a really high viral load is further away, the signal might look the same, right? So those are kind of some of the problems we're really trying to build a model to try to account for some of that uncertainty. And right now, what we're doing at the state level is looking at simulated data. So we take certain assumptions about what we know from the literature. For example, again, an eye chart here, but kind of showing there's a trend of how, if on the x-axis you see the days since the symptom onset, and then the y-axis is sort of a logarithmic scale of how much shedding is happening in per gram of feces. You can see that these were data from Germany and China. There's not too many studies on this, but you can see there's a decreasing. There's some peak somewhere of viral shedding, and then it decreases. But what's interesting is that people are shedding virus even after they're infectious. So when they're recovered and they're exposed, there's probably some shedding that's happening. So we got to take that into account into the model. It's not just infected people that may be shedding. And then we can build these fake data simulations. So here we have on another eye chart, and I'm not going to go through all the details, but at the top we have a simulated epidemic for various towns. We just conveniently labeled them A through D, or A through E in this case, Afton through Encampment, with a various proportion infected on the second line, and that translates into some concentration we might observe in the wastewater. And then finally, at the very bottom, you can see what results we might see from the lab. So there's those threshold cycles I talked about, kind of what we might see from that particular epidemic. It's sort of this inverse, right? Because the fewer threshold cycles, it means the more concentration might be in the waste stream. So at the end of the day, I don't mean to go into all the weeds here, but I want to point out, these are kind of what we're doing right now to kind of estimate what we might see when we actually start getting real data. And then finally, once we get the data, we're building this sort of dashboard. You'll see a map of the state. This disclaimer here, obviously, Cody has had several non-detects, so it shouldn't be read. But basically, this is sort of a simulated, what you might see if you go to this dashboard. It'll be a Google map base. There'll be little dots around the state on the entities that are participating. They'll be color-coded according to, how we might be estimating the risk. maybe the attack rate of the virus. If it's above a certain level, you might color code it yellow or red. So just at a glance, you might be able to see if you're the governor, or a state health officer, where, really do we see this epidemic really progressing? It's kind of the goal. And then you might click on a dot, and then you'd see, this is again all fake data. You would see just, for example, the raw lab results from that count would pop up, and these would be reported immediately. So as soon as a lab enters them into this data collection tool, they'd be available on the dashboard. And then finally, the model estimates would come later. So we'd have maybe 4 graphs that would show the various model estimates on the percent of people that might be infected and so on. So the real goal is, through this online tool, whether it's locked down and limited to just local officials and the state health officer and the governor and health staff, or whether it's publicly available, the real goal is to have this consolidated sort of statewide view of what might be happening with respect to the pandemic, based on all the data we're getting from every individual, as many individual cities and towns participating as possible. So again, just some potential benefits that we see from this. We don't think this replaces individual testing, obviously. It only provides community level information, so it's not identifiable. We're not gonna be able to track and know who these people are, and we can't contact trace and stop an epidemic based on this. But what we can do is use this to really try to be a relatively objective gauge of, how things are going across the state. So not necessarily, when you test a lot more, you might get a lot more positive results. That doesn't mean you're going to have more people with COVID in that community. It could just be you're not testing enough, right? This is, by contrast, is much more objective, because you're really looking at sort of an unbiased perspective of what the prevalence might be in that community. Although there are some complications. You can see on that bullet, for certain communities with really high septic system penetration, we may not be getting a really objective view. So there are limits to that as well. But at the end of the day, we want to allow for some targeted sort of policy decisions by state and local level officials, and then really take the burden off individual communities and sort of do the state coordination to limit the costs and really make it actually net cash flow positive to you, probably, based on all the incentives that we have in the sampling contracts. And then again, how can you participate? I'm wrapping up my slide deck here. We should have an approved contract template by the end of this month. It has to go, unfortunately, through this bureaucratic process. And so once the template's approved, I can send it out. You can use that to bring to your leadership, your city council, your wastewater authority, whoever would approve that contract. And then we can get it signed on our end, and then it'll run through the Attorney General again for hopefully no more than 3 to 5 days to sign it. And then at that point, we can start paying you for those samples. But then we basically coordinate, before that, we could certainly coordinate, getting those kits shipped out and getting all the information we need to begin that testing process. So I'd encourage you, if you are interested, your city and town is interested in this, please contact me. I'd be happy to send you that template. My email is franz, franz.fuchs, F-U-C-H-S, @wyo.gov. And my phone is 777-2865. So feel free to call, email with any questions. Just happy to talk to you about this. We are really kind of building this thing as we're flying, so there may be some questions I can't answer, but we'll certainly do our best to try to figure things out as we go. So with that, I am happy to take any and all questions for the remainder of this the WAM webinar. And again, thanks Justin and WAM for putting this on and letting us get this word out.
You bet, Franz. We appreciate any and all subject matter experts from the state being willing to come on and talk with our members. And this particular program, I like what the state has done as far as the reimbursement. I think is fairly generous. I don't think that they're asking. I don't think there's any unfunded mandate portion of this proposal. I think they've done a good job of making sure that it's not going to, especially in trying times, that it's going to be create any extra financial burden on the communities that care to participate. But I think the data that could be derived from it is incredibly valuable. So I would encourage anybody, if anybody does have any questions for Franz, this is an excellent opportunity to go ahead and ask those.
This is Bob Oblandi from the town of Alpine. Can you hear me?
We can, sir.
Okay. I assume you're sampling influent versus effluent on the treatment plant. Is that correct?
Yes, sir, that is correct. It would be raw influent.
Okay. And how many times are you anticipating the sampling to be required for this program?
So we are actually not requiring any minimum. We are paying per sample, so we're incentivizing, and we're actually capping it at 3 per week. So I think even 2 is a burden, but we'd love to have at least 1 per week is kind of our target.
And how long would this go on at 1 per week or 2 per week or whatever?
That's a good question. So we have the CARES Act funding. Well, we have to expend it by December 30th. So what we're trying to do is structure the contract so we will pay per sample up until December, and then if people have been participating since then, or basically consistently until December, we'll pay a lump sum that's intended to really cover until June. So really, the idea is this will go on until June or until the pandemic is over. There's a vaccine or some, it's been contained, or we don't feel like there's a need to do this anymore. But really, the contract period is until June 30th, 2021.
And the measurement that you're using is copies per milliliter. Is that correct? Am I understanding that?
Yes, sir. So that the raw data that comes out of the lab is really this sort of the cycle counts. They basically amplify this RNA on an exponential level, and so how many exponential cycles it takes to get to show up at a certain threshold is what the raw data is, and they translate that into a measure of concentration in the sample. So the sample might have had a certain number of copies, genetic copies or viral, virus particles per milliliter, and we have to work backwards to figure out, okay, what does that mean, for the potential initial, because there's some half-life, right? There's the sewer might take 6 hours from someone going to the bathroom to it showing up in the collection point. And so there's maybe the virus degrades at a certain rate depending on the temperature of the wastewater. There's a lot of variables there. At the end of the day, what we're trying to get though is not just the copies per milliliter, but some estimate of prevalence. So showing, what, between 1 to 3% or under 5%, or some percent of people that may be infected in that community, and also the trend of that over time. What's the estimated attack rate based on the trend we're seeing in that concentration. So ultimately, we do hope to have more valuable information out of this than just the sample concentration. Does that make?
I think so. And then one final question, I'll let somebody else get on here, is you'll put this information on the dashboard, so this is all public information that anybody can see. Is that correct?
So it will be on a dashboard. We haven't decided, and we certainly would love feedback, locked down or password protected, to just allow access for local officials, county officials, the state health officer. But I do think it's a good argument for making it public as well. So that decision really hasn't been made. The data itself ultimately will be public, but I'm not sure how the presentation, of and communication of that data, how that will look exactly.
Very good. Thank you very much.
Hello, this is Bruce from the city of Casper. Can you hear me?
We can, Bruce.
A couple of questions. You mentioned early on in the presentation here that it's looking at city by city. How about a facility that's regional, that's taken in multiple towns and cities?
So that's a good question. I think if we can figure out a way to map it, if we can get the boundaries of that system, we could certainly display it on this map. Right now we just have little dots, but those could certainly be city boundaries or boundaries of the, as long as we have the GIS data, we can certainly do that. We could also do sub-city, sites. If, for example, a city wanted to dedicate a sampler to testing raw influent coming out of a nursing home or a school or some other, more localized site, we could certainly try to display that as well. But at the end of the day, all the data will be communicated by site participating. So if it's a regional site, we'll just report it as such. If not, if it's just a city or a sub-city entity, we'll try to figure out a way to communicate that effectively. But we're not limiting this just to cities. It really in a way, but sub-sites and larger regional entities are certainly welcome.
And then if our attorneys have concerns with the draft language in the agreement that you've sent out and want to make some changes, is there somebody at the AG's office we need to get a hold of or run that through you, or how's that
Yes,
work?
I would be the point of contact for that, a draft version of the contract. Now, we'd like as early as possible because what we're hoping is that the AG can just approve it, and then we can just sort of reduce the turnaround time for each individual city and town by just having that template approved. And really the issue is the boilerplate language. It's really negotiable. We're not trying to put anything really onerous in there at all, but a lot of it's just sort of standard template language in either a state contract. But certainly I can send a draft version of that, and if you have feedback on anything that might be provide heartburn, we can certainly try to look at that.
Okay, I have a draft copy of the agreement, so we're good to go there. Yeah, that's all my questions. Thank you.
Thank you, sir.
Franz, this is Rocky Case from Cheyenne.
Hey, sir, how are you?
I'm well. How are you? Thanks for putting this on. I don't see anybody else from Cheyenne on this call. I just want to make certain that we're doing what we need to do to get in line for this. So that's all.
Yes, sir. We've been working with Board of Public Utilities and the folks at the wastewater treatment plant, and I think we just have to work through some of the contractual issues. And I'm happy to talk to you offline about that. But we'd love to, move forward with as many cities and towns as possible. So we'd love Cheyenne to be involved.
Okay, great. Thank you.
Anyone else? Oh, hold on a second here. I've got one question on chat, Franz. Let's see. Is there a risk of infection by those who will be conducting the sampling, and what is it?
Yeah, that's a good question. The studies that I've seen have generally said that while there is viral RNA that's still in the detectable in the influent, there's very I guess less active virus, living virus in there than they'd expect. So I wouldn't say it's risk-free, and I think you would want to take the proper precautions, just like you would dealing with influent for any other virus or organism. But I'm not sure there's an elevated risk, particularly in the case of this virus compared to any other disease you could contract from handling wastewater.
In this particular testing process, I mean, you're not, as opposed to the sewage that's going through your facility right now, you're probably not upping that exposure risk necessarily, right?
I think, Justin, I mean, there probably is some added risk to taking additional samples. I'd have to, I'm certainly not a wastewater expert, and I'd certainly have to rely on those folks, in their facilities, as to how many samples they take, what they calculate the risk of exposure is, what precautions do they take with PPE, and how does adding an additional sample affect that. I don't want to say there isn't a risk, but I'm not sure that the I haven't seen any evidence that the risk is that's virally, it's really contagious through wastewater. I think you just take the standard precautions you would with wastewater generally, which is I would imagine not a very healthy or fun substance to work with generally. But yeah, I'm sorry, I'm not an expert, so I can't talk to the added risk to the treatment operators.
Okay.
This is Philip Bowman from the city of Cody. Can you hear me okay?
We can, Philip, go ahead.
I would offer, as we've been doing our sampling, I think that's generally accurate the way Franz explained it. Our operators are just using the standard precautions of, wearing gloves or other PPE when handling the sampling from our composite sampler versus the sampling that they do for our normal permit requirements with grab samples. So I personally read some of those same studies I think Franz is referring to, that, there is some genetic material from COVID in the waste stream, but it's generally not believed to be as contagious once it's in the waste stream. So, while I think Franz is right on based on what I've read that, that there's a risk and you can't say for certain that there's no risk, but it's in line with just the common practices that all our operators are doing for good precautionary measures and safety in normal wastewater plant operations. So we've had 3 samples total drawn now and used our composite sampler for 2 of those samples, and it's gone pretty smooth. We've been pleased with the process and not found it to be overly burdensome time-wise. So we're on board and ready to continue participation with Franz in the state lab versus the private laboratory that we've used for the past 3 tests.
Thanks, Philip, and really appreciate you providing your perspective there, because you guys are the experts. I'm certainly I'm just a bureaucrat here. So thanks for weighing in.
All right. Anyone else have any other questions?
Bob Oblondy again from Alpine. Question to Cody: how often are you sampling per week?
When we first signed up with the private laboratory, BioBot, out of the East Coast, I think they're doing all their laboratory testing in Massachusetts. We signed up through their pro bono, what they're calling their pro bono program, and that was only a charge of $120 per sample. So our initial intent was to sample once per week with them. And by the time we got our equipment and got things up and running, we were down to once every other week. And talking with our health official, our county health official, he was comfortable continuing that with those sample kits we received at a rate of about once every other week. And that was primarily influenced as well by the fact that we were getting non-detectable levels. Obviously, we had a pretty low case count of only 1 to 2 cases for the first several months. Our local case counts increased substantially over the last 2 weeks. And so we are anticipating that we'll start getting some detectable levels in our next samples. But in general, over the last probably 6 weeks, we've done the 3 samples and tests. So once every other week has been our pace thus far. And we are equipped, though, and ready to do the once or twice per week when Franz and the state lab is up and running.
Thank you very much.
You bet.
And this is Franz. I just add that the reason why we're looking at twice per week is, and I don't know if you can see the slides here, but when an epidemic gets going, it grows sort of exponentially. So you don't get many, the time frame between one observation to the next can really matter as far as being able to perceive that slope in enough time. So I think what we're really intending to do is kind of adaptively change the sampling. So if we don't see much activity, we might go to once a week, but being able to scale up to twice or 3 times a week, I think would really help, at least from a data perspective, with all the noise that we're going to get in this process, combined with the exponential nature of how these epidemics grow. It can be pretty important to limit that, to get that time down, that time frame down.
So I guess quickly, one thing I would offer, Franz, I was a little bit late joining, and I apologize if I missed this, but did you talk at all about the testing procedures or laboratory analysis procedure and how that is tied to your flow from your community?
Yes, sir. Yeah, I kind of went through some of the slides I see you're on the phone. You might not be able to see the slides here, but basically talked about kind of walking through from the testing or from the sampling all the way to the testing. We're really trying to keep the timeline as tight as possible and be able to handle the workload. We also are exploring working with UW at some point to be able to increase our capacity. So once we do get above a certain threshold of cities participating, that time frame we can keep it tight. and keep the turnaround pretty quick.
Sure. So I think one piece of data that, and I apologize, Franz and I have been speaking a lot about this over the last few weeks, and one piece of data that we provide to BioBot, the private testing laboratory, is with each 24-hour composite sample, we also provide them what the flow through our plant was in that 24 hours. So as an example, our first couple flow rates were about 0.6 mgd on our first two samples early in the season, but our last sample here in the second week of June was at 0.8 mgd. So we had seen about a 33% increase in flow through our plant, which is attributed to our tourism activity. So if you are doing, using a composite sampler, one of the things I think Franz is going to need from all of us is that flow rate, the actual flow through your plant during that sampling period of the 24 hours. And that comes into play for all of the additional scientific analysis that Franz and his team does. It is proportional to the flow, and that's how it's backed out to the number of potential cases based on flow per capita and the flow that your plant's processing in that 24-hour sampling period. So I just share that as well. That was one of the things that kind of caught us by surprise on that third sample we drew, is the fact that our flow was so much higher, and we anticipate that continuing to increase here for us in the summer with more and more visitors coming to our area as a tourist town. I suspect some of the other cities might be a little more stable where tourism impacts aren't quite as great, but that's one of the unique things that we're dealing with here, is trying to utilize this tool. I know our county health official is very interested in trying to utilize this for trending to estimate what visitors might be bringing into our community and shedding, what visitors might be shedding virus.
Yeah, thanks, Phil. That's a really good point, and I didn't get into some of those details, the kind of information we'll need in addition to the sampling. I think, along with the flow, just for everybody's awareness, we'll probably need some, at least weekly estimate of the temperature of the wastewater or ground temperature to estimate, try to the half-life. And the historical, we'd love to have historical wastewater data as well to kind of be able to correlate a census population with, kind of winter flows, particularly in areas where there are a lot of tourists that might change the flow rate in the summer, like Cody. So thanks for pointing that out.
All right, I don't see any more questions through the chat. If we don't have any more questions over the phone or over the Zoom, I'd like to go ahead and thank Franz from the State Department of Health for his time, and thank all of you for taking some time out of your day to take a look at this presentation. We did go ahead. I always record these presentations, so I'll get it uploaded so that we can share out a link. So if you do want to take this back or share it around to council or other decision makers or other folks involved in your departments, as well as I'll touch base with Franz and make sure that I get his PowerPoint as well, so that I can attach that so you can take a look. And again, if you need to share that information with other decision makers in your community. But again, I think this will be an important tool. A lot of states across the country, and obviously even here in Wyoming, are starting to see a pretty pronounced expansion in the number of people that are coming down infected with COVID as we've opened up a little bit more commercially, and people have started to mix and mingle a little bit more. So I think, as the state navigates that, as many states across the country are going to have to, I think this will be an important tool, and participation of cities and towns across the state will be very important for its success. So again, I appreciate everybody taking the time out to view this presentation and show up for the meeting, and hopefully as many of you as possible will get in touch with Department of Health and with Franz and get on board with this. So.
Justin, before you leave, how did you get a copy of this presentation? How do we do that?
I'll broadcast this out to the same email list that I sent the initial invitation to.
Very good. Very good.
And then I'll post links to it as well. We have a COVID response or a COVID resource page off of the front page for WAM. But I'll send it out, and hopefully that'll make it to the same spots. But I'll send it out to the same email list that we sent the invite out to, with a basic link to the same to a video of the same presentation, as well as a PowerPoint or PDF file with Franz's slide deck. That way folks can take a look at it. And like I say, if you need to take it back to decision makers or want to share it with other folks in your departments or in your communities, that way you'll have that. And hopefully it takes a minute for it to compress the video, but fingers crossed I should be able to get it, that posted by later this afternoon.
Excellent. Thank you.
If there's no other questions, thanks everybody for coming, and we'll get that information out as quickly as we can, and hopefully everybody can take advantage.
Thanks, everyone. Thanks, Justin.
You bet. Thanks, Franz.